working with Dr. Shin. I was going to see you first, and then he'll be in here after me.
Okay.
Nice to meet you.
Nice to meet you.
I was just going to go over your history, and I was talking to Mary a little bit about your symptoms, mainly pain on and off and neuropathy.
Yes, ma'am.
And then Dr. Shin will look at everything, and then he'll be in here.
Okay.
So it sounds like you had initial workup and then had surgery where they took out your primary tumor and had a leak from that. Did you have like a drain?
Yeah, they had the cancer was invading my pancreas, and so the leak was coming from the fluid from the pancreas.
Okay.
So I had that drain for about 2.5 months.
Okay.
Something like that.
Then they were eventually able to pull the drain.
Yes, ma'am.
And then you started on chemo around December, about a year ago.
Yes,
started.
ma'am.
Okay.
Yes, ma'am.
And you were on the pump, the 5FU pump, the one that runs for like 2 days.
Yes, ma'am.
And
yes,
then
ma'am.
you also got the one that caused like the cold sensitivity.
Yes, ma'am.
Okay.
Yeah.
And and it looks like you were also on Avastin, the bevacizumab.
Yes, ma'am.
Okay.
Yeah.
So you took that, and then you had allergic reaction to the oxaliplatin?
Yeah, but it was due to my potassium being extremely low.
Okay.
And I hadn't had any. I had the normal effects from it, which I could deal with. Just being sick the next day. I already knew what to expect. So.
Right.
But my potassium was low, and I had a talk with the nurse, and I told her, I said, I don't think you should be doing it with my potassium being low. And she didn't really seem sure, and it was my fault too, because I shouldn't have let her proceed it with it. Make a long story short, she gave it to me along with the potassium, and I had allergic reaction,
Okay.
and they thought I had a stroke.
I saw that, and they worked it up. It wasn't a stroke, but then they thought it was allergic. Did you get any more oxaliplatin after that?
Yeah, I told them to give it to me because I knew that wasn't it.
Okay.
But I did ask them to lower the dose.
Okay.
They did, and I didn't have any problems with it after that.
Okay.
At all.
So you got all the chemo that you normally got before after that reaction, and you were fine.
And I was fine.
Same side effects that you normally were having, not.
Yeah, and actually the side effects kind of went away. Like I wasn't
With
even taking
dose.
chemo anymore because I had been taking it for so long.
Yeah.
And even a stronger one, I keep forgetting. I can't. What's the?
The oxaliplatin, the one that caused the cold sensitivity.
Oh yes, ma'am.
Yeah.
Well, it did that, of course, but like for me losing my appetite and feeling as tired, none of that
Wasn't
happened.
bad. Okay.
No, ma'am.
Not as bad.
Not as bad.
So you finished, your last chemo was the end of September.
September 28th.
Okay. And since then we're coming here to do new scans and see the surgeons, and it sounds like they saw some progression of disease and wanted you to see Dr. Shin.
Yes, ma'am.
Who is your oncologist at Texas Oncology?
Dr. Normal, but I don't care for her too much, and I wanted to, and I've already told her that I didn't want her to be my doctor anymore.
Okay.
So I'm in the process of trying to find me another oncologist.
Okay.
So I don't know if that means just coming here or maybe partnering up with, Tyler. But I don't care for Texas Oncologist.
Okay.
In Longview, where I've been recently going.
Okay.
Yeah.
So what we can do is Dr. Shin will look at everything, and then we'll kind of see what he would recommend to do at this point in time. He may recommend to go on a different chemo regimen.
Yes, ma'am.
There's another chemo regimen that you get, the pump drug, the one that runs for 2 days.
Mm-hmm.
That's kind of a base drug that they give with a few different other chemos. So one of the ones is the oxaliplatin, the one that caused the cold sensitivity that you've gotten. So there's another one too. It's called irinotecan. But there's so we'll kind of see what he would recommend to do. And we can definitely work with anybody outside of MD Anderson, because that would be kind of closer. It's kind of a long drive. We can see if Dr. Shin, if he has any recommendations for that area. I'm not sure if he does, but we can do whatever you want to do. So I think that we'll see what he recommends, and we'll see if it looks like they did some kind of molecular test, they did ctDNA, and we'll kind of see if he needs any other kind of molecular testing or anything to look. sometimes they do that to see if there, in the future, if there's something very specific about your tumor that they could kind of try to target to treat. So
How would they do that?
just with certain medicines, like certain drugs. Yeah.
Okay.
Yeah, but we'll kind of see what he'll look at everything and see what he says.
Okay.
What other medical problems do you have? Any other medical problems?
No.
High blood pressure, kidney problem, heart problems, none of that. And when you were on the chemo, you had the cold sensitivity, numbness, tingling. Do you still have some of that?
Yes, ma'am.
Okay.
Even now.
How bad is the symptom?
It's the numbness where I'm dropping stuff all the time that doesn't happen anymore.
Good.
Every once in a while, if I'm wearing sandals, I don't know that if one falls off, I don't know
Can't
that
tell.
it's off.
Okay.
Yeah. And it tinkles real bad, and cold air bothers me real bad till I get really sleepy.
Okay.
And I can barely walk, and I just can't really do anything. So I tend to stay home a lot, so I won't make anybody else uncomfortable. With the air, with the heat being on and everything. Yeah.
So it's mainly when it's cold, like if you're you went out today, it just
or like air conditioners, it just, I just feel terrible.
Okay.
Yeah.
Okay.
And it makes me sleepy. I just get really sleepy.
Okay.
Yeah.
Have you had any trips or falls?
No, ma'am.
No. Okay.
No, ma'am.
When you were on the chemo, you had some fatigue?
Not really.
Not really?
No, actually, I can't remember. I can't really remember having fatigue. Well, no, I'm thinking about nausea.
Nausea.
Yes, I was fatigued all the time.
Fatigue,
Yes,
nausea, not really a big
Mm-mm.
problem.
No.
Okay. What about mouth sores?
No.
What about diarrhea?
No, ma'am.
Okay. What about blood count issues? Did you ever go in and they were like, your blood counts are too low?
Went up, went down.
Yeah.
I think one time we got a grip on it, but most of the time it was I think maybe 3 times they had to skip my chemo due to my blood count being too low.
Okay.
At least 3 times that I can remember.
Do you remember which blood count? Was it your white count or your hemoglobin? Was it anemia or your white count or platelets?
I think it was my white count, if I'm not mistaken.
Okay. Did you ever have to get a shot for your blood counts?
Ooh,
No. Okay. No. Okay. Any other problems with the chemo?
No.
Side effects?
Just just the normal when you first start, the metallic taste or, not being able to eat. Never really had a problem with nausea.
Okay.
Just tired all the time, you know.
Yeah.
That's it.
And you have a port?
Yes, ma'am, I do.
Okay, and it's working good?
Yes, ma'am.
Okay. And your surgeries, you had the colon surgery. Any other surgeries?
No, ma'am.
Any family history of any cancer?
My grandmother, my maternal grandmother, she was up in age.
Okay.
And then now my auntie, she's 60-something years old, and her colon just bursted.
Oh,
Yeah,
no.
and but I talked to her last night, and she told me. Yeah.
I don't have any. There's no Kleenex in here. You got some though.
Yeah, I think she has colon cancer. She's been bleeding for a year and didn't say anything because of what I was going through.
I'm sorry. She lives here, she lives nearby, or she lives far away?
She lives kind of far
Far
away.
away.
Yeah, it's still in Texas, but
And you're working now or not working? Okay. And when you're at home, you're resting most of the day, or you get up, you're able to cook your meals and.
Oh, she be up clowning with me. She be active.
so I haven't had the chemo, but before that, I was
Before that, you're pretty.
in the bed all the time.
Yeah. Okay. listen to your lungs and your heart. Get you to sit forward just a little bit. You can take some breaths. One more time. Got ahead of myself, sorry. Any swelling in your legs?
No, it's just my this right knee hurts, a lot. What is it?
Is it from the neuropathy or you injured it or?
Oh, no, from neuropathy.
Okay.
Yeah.
Are you able to like lift your foot up and down?
Mhm.
Yeah, okay.
Yeah.
Just, it's pain. Pain more than numbness? More pain than numbness?
It's more numbness and just pain when it gets really cold.
Okay.
Yeah.
In your abdominal pain that you have, you take your medicine for it and it helps you?
Yeah,
It gets it to a level that's,
The Dilaudid actually stops it completely, and I know how bad it can get.
yeah,
So I go ahead and take something as soon as I try not to take it all the time, but when I know it's gonna get really bad, cause I've been in a position where I couldn't move.
yeah.
And but I've started feeling more pain on my right side since I haven't had my chemo.
Okay,
Yeah, and it's dull pain. It hadn't been any short pain.
okay,
It was really bad over here where my first surgery was. A lot of short pains, and like I said, I would literally have to stay still and couldn't move after I took my medicine. I was just crying, holler.
yeah,
And but the Dilaudid helps a lot.
Okay.
It just makes me sleep.
yeah, yeah.
You know.
And your doctor, you see a pain doctor or a palliative care doctor, or your oncologist gives you that at home?
She does if I talk to her. She, like I said, to me, she doesn't do what she's supposed to do, and she forgets a lot. Like if I tell her I'm hurting really, really bad and I need pain medicine, she never calls it in.
Okay.
Yeah, I did see a pain management doctor, I think here,
Okay, oh yeah, that's where I saw the note. I
Yeah,
saw a
yeah,
note from
yeah.
palliative care.
and that's where I got the Dilaudid and
Okay,
you
good,
know,
good.
from.
Okay, got you. I saw it somewhere. I was
Yeah.
thinking I was in, because
Yeah.
we have outside records and inside records.
Yeah.
Just trying to- Yeah. I'm gonna lift this up and I'm gonna want your push. And I was gonna listen to your belly.
Okay, yes, ma'am.
Pull this out for your feet and then I'm gonna push this down. Are you able to lay back, okay?
Yes, ma'am.
Yeah. Just for a second. Listen to you. Any pain, any pushing on you?
No, ma'am.
Let me just lift it back up here. Let me get Dr. Shin in here. We'll look at everything and then we'll see what he's recommended for you. Okay? Is that too low or is that okay? Your chair.
This is fine.
It's fine, okay. I don't know. Nice to meet you.
Nice to
Yeah.
meet you.
Nice to meet you.
So, and what's your relation?
I'm her daughter.
Okay. All right, nice to meet you both. And where, I'm told you guys are from Longview.
Yes,
Gotcha. How long does it take to get here from there?
about 4.
About 3 hours. Well, 2.5 with me driving, but you know.
Okay. Well, that's not bad. Okay. So that's okay. I'm still learning. I've been in Houston 4 years. I'm still kind of learning
Oh,
my Texas geography. So,
okay.
Gotcha.
Okay. So, and you previously had seen Dr. White
Yes,
and
yes, sir.
the peritoneal surgeon and Dr. Trankow, the liver surgeon.
Yes, sir.
So I understand that the plan had been to do surgery both
Tomorrow.
in the peritoneal, and then later the liver. Was that?
Yeah.
Or was it
Not-
all
not
in one?
like-
Was it going to be all in one?
Yes, sir, all in one.
All in one. Okay.
Yes, sir.
Okay, but that is now on hold because it looked like the tumor has grown, and that's why they wanted you to see me. Is that okay?
Yes, sir.
Did they explain to you kind of why they didn't think they could do the surgery?
Yes, sir. Because the tumor, the mass on my liver has enlarged, and there's three.
3 more little growths.
Gotcha.
Yeah,
Basically,
and,
it's mutated.
yeah, and they want to.
Gain control over it again before they go in.
Gotcha. Okay. So this is. Did they give you a copy of the report?
No, sir.
Oh, okay. So this is that's good. So that's a CT scan report. I can kind of highlight that.
Okay.
So the problem is in the liver.
Yes.
So there's yeah. So it's these are the new ones are kind of the most concerning, which is there. And then and a couple of the other areas have gotten a little bit bigger. So the tumor in the peritoneal area, like where Dr. White was going to operate, that has not changed. That's good. The problem is the progression in the liver. The number, those are just kind of referring to like the locations in the liver. But honestly, I forget exactly which is which. To be honest with you, don't tell the surgeons that. Okay, so I think so. So because of that, the plan is chemotherapy again. Now, it sounds like the last time you've been off all chemotherapy since end of September. Does that sound right?
Yes, except for the stronger chemo that causes the cold
Neuropathy,
sensitivity. I've been off that a little bit longer.
Okay, so everything since end of September, and they dropped the oxaliplatin. That's the one that causes the cold.
Yes, sir.
A little before. Okay.
Yes, sir.
Did you have much problems with the chemo when you took it?
No, sir.
Okay.
I did have a reaction to it, but that was only because my potassium was extremely low. The nurse gave it to me, which I told her I didn't think that was a good idea before she did it, and I had a reaction to it later on that day. But afterwards, I asked them to, to continue to let me have it because I already knew what it was. They did lower the dosage, and I didn't have any reactions after that.
Okay. Okay.
Yes, sir.
What was the reaction? What?
They thought I had a stroke. I couldn't
Oh,
talk.
like okay.
The left side of my face, my mouth, and my eye was twitching, and I would kind of go into a daze. But the funny thing about it was, even though I couldn't respond like I am now, I knew everything that was going on. That was a skill. I just couldn't control. I couldn't make my brain. I
Okay.
couldn't.
But it only happened one time.
It only happened one time. Yes, sir.
Okay.
Yeah.
Okay.
And like I said, it happened at one time while she started giving it to me, and then she had like a big bag of potassium. Yeah.
Okay. I mean, if it happened again, I'd be more concerned. I mean, one time hasn't happened again. Don't necessarily think it would happen.
I don't think
Again,
it
so,
would.
okay.
Yeah.
Okay. So we've got some options for what the next type of chemo would be. The standard treatment. So you've had the combination that you had was called FOLFOX because it's 5-FU and oxaliplatin.
Yes, sir.
The standard next combination would be called FOLFIRI, which is the same. The pump is the same. The one that you like get hooked up and get unhooked every few days. That part would be the same. That's kind of the backbone of all chemo for colon cancer.
Oh,
And we replace the oxaliplatin. That's the one that causes cold with the drug called irinotecan. It's reasonably similar